Nearly 1 million people of working age in the UK are living with cancer. In South Yorkshire and Bassetlaw, half of all new cancer diagnoses affect people aged 18 to 64. Sadly, we also have some of the highest cancer rates in England, and too few cases are caught early. Spotting cancer early makes a huge difference. Treatment is often simpler, recovery is easier, and survival rates are higher. That's why it's so important to know the early signs and symptoms and encourage colleagues to get checked. You may ease someone's worry. You might even save their life.
At work, we see each other regularly. We notice changes in moods, health, or energy. Many early symptoms of cancer are common and often harmless, but the right thing to do is book a GP appointment. Chances are it's nothing serious, but if it is, catching it early really matters. For more information on signs and symptoms, visit the Peace of Mind campaign at the South Yorkshire and Bassetlaw Cancer Alliance website.
Look out for general warning signs like a persistent cough, sudden weight loss, or a loss of appetite, even skipping packed lunches. For those working outdoors, keep an eye out for unusual skin changes or lesions on the scalp or back. If you notice any of these, encourage a visit to the GP.
Let's look at some of the key symptoms to be aware of. Ovarian cancer may cause bloating, tummy or pelvic pain, loss of appetite, or needing to pee more often. Other signs include indigestion, bowel changes, back pain, tiredness, unexplained weight loss, or bleeding after menopause. Even if you've had your ovaries removed, check any new symptoms with your GP. Womb cancer often shows as bleeding after menopause, heavier or more frequent periods, or changes to vaginal discharge. Persistent or new bleeding while on HRT should also be checked. Other signs include pelvic swelling, lower back pain, pain during sex, or blood in your urine.
Bladder cancer usually presents as blood in the urine. Painless, streaked, or brown, and it can come and go. Other symptoms include needing to pee more often, sudden urges, or a burning sensation. Advanced cases may cause pelvic or bone pain, weight loss, or swelling in the legs. Any blood in your urine should always be checked.
Pancreatic cancer can cause tummy or back pain, jaundice, unexplained weight loss, loss of appetite, bowel changes, or persistent indigestion. If symptoms change, worsen, or feel unusual, see your GP.
Esophageal cancer may affect digestion, causing swallowing difficulties, heartburn, indigestion, or frequent burping. Other signs include persistent cough, hoarse voice, loss of appetite, unexplained weight loss, tiredness, or chest and throat pain when swallowing. Any new or worsening symptoms should be checked. Most of these symptoms are caused by less serious conditions, but noticing changes early and getting them checked can make all the difference.
Knowing the signs and symptoms of cancer is just the first step. If you notice something in yourself, see your GP. If you see symptoms in someone else, encourage them to get checked and do it sensitively. Choose a private moment, mention the specific symptom you've noticed and suggest they contact their GP. Emphasise that it's normal and expected to get checked, and that early detection improves treatment options.
You can share trusted resources like www.nhs.uk and offer practical support such as helping them book an appointment. Respect their decision, keep the conversation private, and check in after a few days. Your role is to be supportive and encouraging, not to diagnose. Some symptoms may be less visible, like mouth ulcers, lumps, or trouble swallowing. Even these should prompt a GP visit.
By noticing changes and speaking up, you could ease someone's worry or even save a life.